AIDS Healthcare Foundation, an NGO, has engaged religious leaders in the FCT to create awareness and public trust in the safety and efficacy of COVID-19 vaccine. Dr. Ichi Ijezi, Country Program Director, AHF Nigeria, made this known in Abuja during the foundation's campaign tagged Vaccinate Our World. The campaign, which was in collaboration with Nigerian Network of Religious Leaders Living with HIV and AIDS, is to address COVID-19 vaccine hesitancy and global vaccine inequity.
There are inequities that need to be addressed. The statistics have been discussed during the meeting, and we can see that in developed countries, there are over 75% of persons who have been vaccinated. But in low-income countries, particularly even on the African continent, we're having less than 15% vaccination rates. And so we need that gap to be bridged. And so what we are trying to do is to engage different actors who have influence, different actors who can reach the grassroots and different communities to ensure that myths and all sorts of theories are dispelled, and to ensure that people come forward to get vaccinated.
Speaking on global vaccine inequity, Ms. Kemi Bodamasi, Director of Advocacy Policy and Marketing, Africa Bureau AHF, said it was important for religious leaders to add their voice to global vaccine inequities.
Another thing that AHF is asking for under the VOW campaign, beyond the technology transfer and technology know-how, genomic sequencing, and local manufacturing of vaccines and trip waivers, is a global public health convention. The way we have done business in the world in terms of responding to emergencies with health, COVID has shown us that we don't have any plan. It has shown us that even the best of the best didn't have any plan to respond to pandemics. And AHF is saying we need a global public health convention that takes all of us, including the African continent, back to the drawing board, where we all sit, both the developed and the developing countries, where we bring ideas together in transparency and collaboration, and we develop a new global health system.
In his remarks, Reverend Bulus Dakuru, Chairman, Nasarawa State West Senatorial Zone, Christian Association of Nigeria, called on world leaders to raise $100 billion to secure sufficient doses to vaccinate the world.
We strongly want to ask the global world, the leaders of the global world, to make available or to raise at least $100 billion so that we'll have enough vaccines in order for everybody to have access to be vaccinated. By so doing, it will go a long way.
For his part, Mr. Musodik Oladepo, member Mission Board of Al-Hibibiyya Islamic Society of Nigeria, called on world leaders to promote international cooperation, not politics, as the driving force for ending the pandemic.
They should be compelled, or they should compel themselves to share their surplus vaccines, stockpiles, not expired ones, the valid ones. Yes, they should give us those ones that are not at short lifespan, but those that have long lifespan that are still in their stockpile should be shared with other countries of the world. At this time, when majority of the world has little access to vaccines, all these nations should establish a framework to ensure that all other rest of the world are also protected. Because if just one country is not safe from COVID-19, none of us globally is safe.
Executive Secretary Narala said that religious leaders had a role to play in informing and influencing communities on health matters.